Hello, 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 and welcome back to another episode of Mind Your Body and Soul. We the healthiest podcast you have ever heard in your life. I am Joseph Ward, and I'm joined by the good homie, Mr. Mathias Sweet. What's going on, Montez?
Nothing much, Mr. Josian.
Somebody called earlier today. It's like, can I speak to what's his name? Like Matthias. Like, yes. We're gonna teach people how to say your name. Okay.
We just gonna tell them my name's Sweet, and that's it.
Exactly.
They can't go no further. But it's okay.
Right.
You know, I answer to anything as long as I'm coming late for dinner.
There you go. So, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics they may not have access to. And we seek to inform, empower, uplift, and mobilize our listeners to becoming the healthiest versions of themselves. Remember, you can always find this podcast every Wednesday on our website, www.nmcpodcast.com. But make sure you check out our parent website at www.neighborhoodmedicalcenter.org. Go to that website, a whole bunch of information and resources for you. We're also available on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, right here on YouTube. Make sure you subscribe, comment, like, and share because that's how more people can see this information. Because that's the whole purpose of that we do this so we can inform our people. So make sure you all do that. And we thank everybody who's been supporting us. And thank you and welcome to all of our new listeners and supporters. All right. So today we got a good one. So we have our CEO. We have the person who's driving the ship over here at Neighborhood Medical Center on our podcast. So we are thoroughly excited and to be graced with your presence. So welcome, Miss Jeanne Freeman. How you doing?
Thanks, guys, for having me. I feel like a local celebrity now that I get a chance to be on your podcast.
I mean,
Yeah. Well, welcome to celebrityness.
we're trying to step our game up, you know. But so I want to say this because I always make sure I give people the best introduction I can. So the first time I met you, it was a meeting when I was at the health department. It was a meeting between the health department and neighborhood medical center, and it was the way you were carrying yourself. It was the way you handled the whole situation, the interview. Everything was good. The sit down, everything was good, but just the energy that you brought during our sit down, our meeting, I was like, okay, and that was my first time meeting. I'm like, okay, she cool. I go off of vibes. I'm like, she's cool. But then being able to work alongside you when I was at the health department, I got to know you better. But now, as a staff member of Neighborhood Medical Service, Medical Center, I want to say first, thank you for your contribution to healthcare in this Leon County area, especially somebody who's from here. You're not even from here, and you care about this community like you was born here. So I do want to say thank you for that. But the vision that you have, you're not closed-minded, you're open-minded, you're willing to learn new things, you're willing to go outside of the box and just allow us to do what we need to do. One of the most powerful things I heard you said was like, I know I'm the CEO, but I don't know anything. That's why I hired you. Because you're the expert at what you do, so I'm gonna let you do what you do. So that's music to my ears. So thank you for just your approach to healthcare and being the CEO for Neighborhood Medical Center.
Well, it takes teamwork. Teamwork makes the dream work, and we got an awesome team here in neighborhood. So I could not do any of this by myself. So that's just a shout out to everybody who works in neighborhood.
Yes, ma'am. Yes, ma'am. All right, Matilda, you got the first question. You know how this do.
All right. Well, Miss Jeanne, can you let our audience know a little background information about yourself and tell us why you think community-based medical centers are beneficial to our community?
Well, I am a social worker by trade. I'm from Fort Lauderdale. I moved up here, came to school, and you come to Tallahassee. It's so many of our stories. You come, you go to school, and you don't leave. Yep. So I'm still here. I've been here since '97. And I like Tallahassee. First and foremost, I'm a mom, so I have 3 kids. Love them to death. So this seems like a good place to raise my kids. I was about to say my boys, but now I have a daughter. So, it's just a good place to be. Tallahassee is a good place. I am a third generation Rattler, so I have spent a lot of time in Tallahassee. So it was just, when it was time for me to decide on where I was going to college, my dad was like, "You can go wherever you want, but my money will be at FAMU." So, oftentimes us Rattlers and when you have legacies at certain schools, that's just where you got to go. So I was like, well, FAMU, here I come, because I was like, I'm never going to FAMU. When you spend so much time up here and you come into homecoming and all the games, you're like, yeah, I'm good. I know the FAMU experience, but it was definitely one that I would never trade. My time at FAMU, a historically Black college or university, it was an amazing time. So I stayed. I have a degree also, a master's in urban and regional planning. And that was a little different because I used to always wonder why railroad tracks separate neighborhoods, why there's certain things on certain sides of town, transportation, public transportation. So I decided to go get a degree in that, and that's urban and regional planning. So then after that is when I got the master's in social work. So I've always been a people person. I take pride in meeting people where they are because somebody had to meet me where I was. So I like to give back and help. So Mathias and I started working in the neighborhood, I think around the same time, was it the same week or something like that?
February 2011.
Right. So we are definitely on our 10-year mark. I can't believe it's been 10 years, but when I think about it, Braylon will be 10. And when I started working here, I was pregnant with Braylon. So
my buddy.
It's been 10 years. 10 good years though. We've seen a lot of good times at neighborhood. We had some ups and downs, but our good times are definitely they outnumber of time. So I'm excited. I'm proud to be at neighborhood. I'm proud to lead the ship. It's just an amazing place to be.
Right.
Health centers are very important, and I'll be the first to say I had never heard of a health center before I started working at neighborhood. When I started working here, we were not a federally qualified health center. I think in 2013, the previous CEO decided to work toward becoming a lookalike. And so we kind of got roped into that process. We learned about, FQHCs and lookalikes, and we were going through that process. And then as time went on, the opportunity presented itself for us to go for full status. And we did it, and we became a health center in 2014. And since then, we've had skates on. Health centers are something that have been around for decades. I don't ever see them going away because their primary focus is to provide access to primary health care. And that is so important in every community, especially when you have underserved, underrepresented minorities, Black and brown people who usually don't have access to health care. At neighborhood and other health centers, we focus on being able to provide the same quality services that you might get at a commercial doctor's office or just a different type of doctor's office. We provide those services here, but on a sliding scale. We don't turn people away based on their inability to pay. And that's an amazing thing to have in your community. So health centers are here. We're here to stay. We're doing great work. We're all going to continue to do great work. So just proud to be a part of the health center movement.
Yes.
All right.
Look, these health centers, because like you, I didn't really understand or know about health centers. And the little I did know, it was through TV. So, you hear about the centers in the Black communities from TV, and they make it seem like it's all bad. So you're like, man, I don't want to go in there. They probably got a skeleton sitting in the lobby or something, But then when you're able to meet people like us and hear our stories and hear us talk about it, you get a lot more information on, okay, so instead of going to the emergency room when something happens, you mean I can get regular healthcare services here, even if I don't have health insurance?
Right here. It makes a huge difference. I think, the pandemic was rough on all of us, but one of the things that I can say that came out of that was positive was bringing health centers to the forefront.
Mm-hmm.
Health centers were at the lead of getting people vaccinated, getting people tested, providing care, providing treatment for people. So now everybody gets a chance to know what we do every day and the things that we know and how high quality the services are that we provide. So I'm definitely excited about that.
Right.
And I know, like, from learning about the health center, when I did my internship here with Neighborhood, I never heard of Neighborhood. I never heard of a clinic that was free to the community. I was like, I always thought you had to have insurance. If you didn't have insurance, you were just out of luck.
Right.
And so when I came started working at Neighborhood, I was like, this really is something that's there. And to me, you get better care at the primary health centers and, say FQHCs than you would do at a regular doctor's office. Some doctor's offices look at you and next thing you know, you sit down in the chair and next thing you know, doctor then spun around and out the room and you done with your visit. And you like, I don't know what just happened. So here you get to spend the time and they call you, they talk to you, you get to know them and they become part of your family. Like a lot of our patients I know, especially in the Ryan White program, we talk to them constantly and we get to become family and friends and see them outside. See babies being born and they become neighborhood babies and come here and get care and see people grow up and graduate. So that is the best part that I love about the community centers. And to me, I think they get better care sometimes than primary care. And people don't really, they underutilize our services. And we do, just for the record, we do take insurance, guys. We don't turn nobody away. So, you can't come here and see us, we can get the insurance. So,
Yes.
And it's no knock to any other doctor's offices or anybody else in the community. It's just, hey, this is our niche. We know what we're doing, and we're going to continue to do it well. So there are a target population of people that we want to provide most of our services to, because those people don't have access to services that other people do. So we want to make sure that these are the people. You are who we're seeking to take care of. You are the people that we are here for. You are why we're here. So, the key is to make sure we get out in the community and tell people who we are, what we do, and why we're doing it. Because the why is just as important as what we're doing.
Right. Okay. So urban planning, you study urban planning, social work. So how did, and 10 years ago you started at Neighborhood, so how did that transition happen from urban planning to social work to you becoming a part of Neighborhood and getting into the realm of public health and even staying this long?
At that, right before I started working at Neighborhood, I was a district site administrator for a mental health agency. So I had gotten out of that arena and still wanted to stay in social work. And someone introduced me to Neighborhood, and I have been here ever since. I started out just as a regular social worker, helping people get signed up for Medicaid or insurance, food stamps, that kind of stuff. Mathias, Luis, and I were sitting in that room at Brevard, and we were making it happen every day, helping people with We Care applications. And then just from that, the skill set that I had allowed me to move up as opportunities presented themselves.
Right. Well, and even to that, could you just for the people, why it's so important to have skills, master your skills, and gain more skills to help yourself advance in life?
Well, you got to have something to back it up. You got to be able to back it up. You just can't stand out here and be like, okay, I'm the CEO just because those are they gave me the job. No, you got to be able to show and prove. Even at staff meetings, you all have heard me say, I'm not going to ask you to do anything that I wouldn't do. Right. So having that skill set, taking advantage of the things that you're taught while you're in college, high school, life skills, you put that to use every day here. And it's definitely important to continue to hone in on those skills, because you never know what you're going to have to do. In public health and social work and in the fields that we work in every day, who knows what's going to happen? Who knows what patient is going to walk through the door and we have to pull something out of a hat and make it happen. Exactly. That is our day-to-day operation. Meet a patient, help a patient, figure it out. That is just what we do.
Exactly.
And that's one thing that I pride neighborhood on, and I look at neighborhood from looking at other entities and going and visiting other places, that you see the whole management team, the whole C-suite jumps in and helps. It's not just one day you might walk in here and see Miss Freeman, the CEO, sitting at the front desk saying, "How can I help you? You have an appointment today? Medical or dental?" So you might see her out in outreach doing outreach events. You might see the CIO out there doing stuff, taking people's co-pays and doing things. It's no job that's too big or too small for us. And that's what I like. And I think that's what brings the health centers to the forefront, because it sees the people who, you know what I'm saying, who have the titles actually down on the lower level, and they make people feel more comfortable because it's not just, I have this title and I'm here and this is what I'm going to do.
And you know what, Mathias, it's not even a lower level, it's just a different level. It's just a different level, because we've all been at different levels before. And now that, you know, I'm at a different level, that's the platform that I use to try to help everybody else. Because nobody does it alone. You always gotta, while you know, reaching up, you gotta put that hand back and bring somebody with you. That's what it's all about.
That's what it's about. So as a woman, how do you feel about the state of healthcare in America? As healthcare worker, how are healthcare disparities being addressed?
Hold on, Mr. Gaines, here you go. I will say, thank you. That's what Mr. Collins. I will say, as a woman, so as a woman, there are disparities. As a Black woman, there are even more disparities. Women are faced with so much. You know, I know that it takes two to be a parent, to become a parent, but a lot of times women are single parents, and they're having to care for children and care for everybody else and work and do all these things, and then their issues get put on the back burner if addressed at all. And then that creates issues for you in the long run, because you've never had a chance to pay attention to you. And our society doesn't do as good of a job as I would like in supporting us in those other realms, so that we can also continue to put ourselves forward. You know, I tell people here, I never want employees to have to choose between their job and their children. You know, your job and your health care. Those things aren't, you know, they aren't me. You can't do that. That's an impossible decision, you know. And as a mother, I couldn't imagine having to say, oh, well, I got to put this job before I put my kids. No, this kid is how I take care of this job, is how I take care of my kids. So I have to figure this out. It has to be a happy medium. So our society has to do a better job of supporting that type of mindset, you know. And as a woman, it's just rough. You know, it's hard. You know, I hear so many stories of people, because I haven't always been a CEO. that was not always my story.
Right.
You know? I look at, sometimes I'm just like, oh, I wonder how I even got through some of that, you know? And that's the story of so many women, especially the women we see here. You know, they've had to take care of so many other people, parents, nieces, nephews, their children, other family members, that their healthcare gets pushed. It just drifts away in the sea. And you know, that is unfortunate. And it's not fair. So I would definitely, I think another thing with the pandemic has helped identify that women were doing so much, you know, that now they got a chance to stay home and still work. A lot of women left the workforce because they had to choose between taking care of their children and working. And that is a decision that nobody should have to do. Our society has to do a better job of supporting those things working in tandem together. We have to do that. You know, that's, it's not fair. It's not fair.
Right. Yeah.
As a healthcare worker, I see a lot of differences. We've been fortunate enough to know how to help work people through this system. You know, we've learned so many things over the years working in healthcare that we kind of know how to manipulate certain things, and not manipulate in a bad way, just we know how to get through certain doors, and we have more time to help people get through those doors than other people do. You know, we've learned things along the way. So that definitely helps us with our patients, but we can't touch everybody. And the same access we have, everybody should have. So that's definitely a part of what I want to see change in our society.
Right. Yeah. Access to healthcare is critical, and that's why this interview to me is critical because they once again being able to put a face to a name, but seeing how human and real you are. And that's I'm just being honest. Like, one of the reasons why I enjoy coming to work is because I know at the top is a real person that I'm dealing with, like real life stuff, and I can come have a conversation with you and not feel like you're gonna be looking down on me or anything. Like, no, you're a real person and you shoot from the hip. I like that stuff. People who shoot from the hip. But it's just, but that also translates to us addressing the health issues and taking care of the people in the community, because you're like, okay, I have a mindset of I'm not different from these people. This is my job, but I'm the same as you all. So how would I help myself?
That's right. Like I tell you all, treat our patients like the relatives you like. Okay? That's how you treat everybody that comes through the door. Treat these patients just like the family members you like. Okay?
Right.
Because at any given moment, that could be you. At any given moment, it could be your sibling, your family member, your friend. That we're not going to treat people. You treat people exactly the way you want to be treated. And if you do that, I promise you it'll be just fine. And we meet the needs of the people.
Yeah. And we're able to do it in many different ways. So we're definitely out here having fun now.
It does make a difference when you come to work and you feel good.
Yep.
Even though we make it look fun, it's a lot of work. Sometimes we make it look easy.
It's a lot of work.
It's a lot of work. It's a lot of late nights that people don't see. They think it's a Monday through Friday, 8 to 5, but all three of us can tell you it's not. We make it look easy.
Yeah,
it's a lot of blood, sweat, and tears that go into holding and taking care of the community.
Mark told me I had a fake maternity leave, so if that helps anybody to understand.
yeah, because
you did.
But you're looking at three people who have similar mindsets when it comes to getting things done. It's like we're gonna go above and beyond to make sure that our community is taken care of and the job gets done on a satisfactory level.
That's right.
All right. So with that being said, we've talked about neighborhood before, but we want you to brag on neighborhood. So kind of give people, for those who don't know, this is their first time watching this podcast, give them an overview of what Neighborhood Medical Center is and how we serve the population and how you are able to serve the population as a CEO of Neighborhood Medical Center.
So for those of you all who have been hiding under a rock and don't know about Neighborhood Medical Center, we have been around since June of 1974. We started out as a small clinic for uninsured and homeless. We've since then grown. We had our main location, the hub was at the Brevard Street location inside of the Lincoln Center. From there, when we expanded our service locations, we went to the Smith Williams Center over on Pasco Street, and we opened a health center in Havana at the Cecil V. Butler Health Department building. Those two locations are still alive and well and thriving. From there, we expanded through a new access grant, we expanded to the Orange Avenue location. Orange Avenue is inside the Richardson Lewis Health Department building. We also have a mobile unit for that location. From there, we opened up a school-based clinic in Havana and at James S. Ricketts High School. So in the Havana Magnet School and at James S. Ricketts High School. Now, with all those locations, we have a new one coming soon. Neighborhood Medical Center, again, on the south side of Tallahassee. Very proud about that. But in those locations, we provide primary care, mental health services, dentistry. We are very proud to have an OBGYN program. Neighborhood, we are taking care of babies. We have a pediatric program where those babies, when they're born from the OB program, mom can take them right over to our pediatrician. We're very proud of all the services we provide. I must also say that we have case management services as well. My job here is to make sure that the day-to-day operations are taken care of at Neighborhood, and to make sure that Neighborhood is visible so that we can fulfill our mission of taking care of people, making sure that people have access to primary care. So that's done in many facets. I'm out in the community, even though I don't like to be on camera. I don't want to hear the sound of my voice on TV. I hate doing that, but it's the nature of the beast. It's what you have to do. The job again is to make neighborhood a lot more visible and to make sure that people know of the services that we have, so that if you know someone in need of those services, you just send them right over to the neighborhood and we can take good care of them.
That's it.
In a nutshell, look, come to neighborhoodmedicalcenter.org. Don't forget.
Yes.
Right.
All right. So that goes into Ms. Freeman. Can you tell us how Fqhc provides medical services different than a health facility that is structured more traditionally?
I don't know if I would call it different, because to me it's the same level of service, if not maybe more detailed. We have more people, more a teamwork approach to integrate, a teamwork approach to how we provide healthcare. It's integrated services. So it's a treatment team approach. So if you come here for primary care, you're just not going to come in here and get a physical. We're going to make sure you get dental. If you're in need of mental health, you can get that. If you're in need of case management, you can get that. We're going to give it all to you. If you're in need of outreach and education, you're going to get that too. So as far as quality goes, there's no difference. It's very high quality services that we provide, but we're able to provide additional services that our patients usually need.
So what are some of those like additional services? So if I was a patient and I came and said I needed some assistance with maybe a blood pressure medicine that I couldn't afford at this one place, is there places that we not like refer, but tell people, hey, you can get it cheaper at this place? Or do we offer programs and things like that that can assist?
Definitely. Through our case management program, there's a patient assistance program. We also, as a federally qualified health center, one of those benefits is being able to have a 340B pharmacy program, so that eligible patients are able to receive their medications at little to no cost. So that is definitely a perk and a difference, as you said, Mathias, in being able to get services at neighborhood.
Okay.
We want to make sure that our patients can get as much as they can in one stop. Because most of the people we take care of, they need that type of service. It may be difficult for them to get here. Transportation. We don't want to become a barrier for access to care. That's the goal. Making sure people get what they need when they come the first time. And if they come back.
Gotcha. So that's so that would be one of the advantages of a Fqhc is a one-stop shop.
One-stop shop.
Patients. Okay.
Yes.
Okay.
So y'all come check us out now. We a one-stop shop now. We want to see more y'all come out here that don't know.
Don't run to the emergency room.
No, come here. Get preventative care. Let our physicians, our nurse practitioners, our pharmacy educator, let these people take good care of you. We're here for you. It is no reason for you to have to go to the hospital for emergency care when you can come here from the beginning and get preventative care. We want to keep people out of the hospital. We want to make sure TMH and Capital Region are able to deal with the emergency situations that they're there for. Let us take care of the preventative stuff and keep people healthy and out of hospitals.
Right. Exactly. So neighborhoodmedicalcenter.org.
Yep.
Cool. So when we're talking about like women's health, specific for neighborhood, what services, because we talked about OBGYN and things, but what other services do we have that will help address some of the women's health issues that we would find in our Big Bend area?
Okay, so we have Dr. Fqhc is our certified diabetes educator. So we have a lot of women who suffer from diabetes or are at that borderline where their A1Cs are pretty high, not within normal range. So we have those options for ladies to come in and have that diabetes education, that nutrition counseling. And it's not just for the patient. We want to bring the family in, because a lot of times it's not the patient that's buying the groceries, it's not the patient that's doing the cooking. We want to make sure it's a holistic approach to disease management. Women can come here and get their well woman visits, because you don't necessarily have to go to OBGYN for that. Come here and get the pap smears, breast exams, mammograms. All of those services are specific to women, and we can do those here on a daily basis.
Right. And that's, to me, that's so important. But also, what I like is the amount of knowledge and care that you're going to get So because you go see the provider, and the provider, if even if the provider doesn't look like you, the provider can understand you.
Mm-hmm.
And I like that's what we bring to the table.
We have a good representation of making sure that our providers look like the people that we take care of. That is very important.
Yeah.
There are cultural differences that we must take into account. So if I come somewhere and you look like me, at least you can kind of understand where I'm coming. You know,
right.
That makes a big difference in people accessing healthcare. And it takes a special person to work at a health center. Yeah. Because these are people that our patients, they become your family. You know, they call you all times a day. They send you messages through the portal. They show up and be like, hey, I need you to put me on such and such schedule. And you better do it, because that's just the type of rapport that our providers have built up with our patients. And that's what you want. When it's time for our patients to make decisions, they don't feel alone. They know that they can come and talk to their healthcare provider and neighborhood, and they will make an educated and informed decision. So our providers are just amazing. I can't talk about them enough. We have a good group of providers, and I'm very proud to work with them all.
Was always fun as well. Like our nurse, Miss Marcia. She has a fan club with a waiting list.
Yes.
Good.
And so that's what's so cool about it, because we've all witnessed on several occasions somebody say, I want Miss Morris. I'm looking for Miss Morris.
Where's Miss Morris? I'm a caller. Okay, we're not scared of her. If you have her number, call her.
yeah, but that's just so cool. But also,
that's definitely a compliment to the providers that our patients seek them out, and it could just be word of mouth. Well, Miss Morris, I heard this, or and these patients come up here and they don't want to just talk to Miss Morris or Miss Steaple or Dr. Richardson about healthcare. They want them to help make other decisions. Mm-hmm. And so that shows the amount of empathy and compassion that they have for the patients that they take care of. It really is something to be proud of.
Yes.
And we get it all the time too, because we had a patient the other day call and say, my friend is the patient of Miss Steeples and I want to see Miss Steeples. Mm-hmm. I'm like, okay, well, we got to talk about some things first. So Miss Morris, and see, well, what do you need? What they said, Miss Steeple is the best provider in the world, so I need to see Miss Steeple or Miss Morris. And I was like, it just don't work that way. But we gonna figure it out.
You just let me see where I can put you in on the schedule
and see what they say. And they get mad too when you move them and say, no, I can't see these people. They get real mad and they call the provider and say, hey, they said I can't see you. Mm-hmm. So I mean, but that is a good problem to have in the community that we serve.
Right. I do want to ask this question though about the women's health, and just for a better understanding from a male perspective and for our other males listening. So when you go to the doctor for your personal health care, and you don't have to get fully into details, but what are some thoughts that you have that may be negative, or some trepidation that you may have when you're going to get health care, that you just don't want things to go wrong, you want things to go right? So like, what are some of the thoughts that you have, or some of the fears that you may have when you go in to receive health care?
I mean, the first thing is, okay, God, when I go to the doctor, they're going to tell me I need to lose weight. When you go, you don't want people to feel bad about that kind of stuff. You want people to say, hey, okay, we know that may be identified as something that's going on. We're going to work with you, get you to a point where you're healthier and you're doing better. So, people have that kind of intrepidation. What is the doctor going to tell me? I'm scared. But this is not a place for us to be scared. We want to identify the issues that you're having and help you get on the path to healing. That's what this is all about.
Right. You heard it. Mm-hmm. So, but yeah, that's what I just want to make sure that people get a good understanding, because yes, even you, somebody who's knowledgeable about the healthcare system, you still have things that you worry about when you go.
You have your anxieties. You have, well, my skin is doing this. What am I going to do? Or it's just anything possible. Especially when you have little kids. You want to be able to come somewhere, and if you have 1,000 questions, the providers that we have will answer every one of those questions for you. And trust me, having a new baby, there's a lot you forget. When your kids are older. So I'm just like, Let me ask. I'm having to write down questions. And that's the best thing you can do. That's what I do when I go to the doctor. You should do that when you go to the doctor. Ask questions, because that's the only way you're going to learn and become educated.
Right.
And our provider, if you have a good provider like we do here in the neighborhood, they don't mind answering those questions. They want you to come with those questions because they want you to leave more educated about your health.
Right.
And that's what we always talk about in the community too, is telling the people that they have to be their best advocate. The best person to advocate for yourself is yourself.
That's
and
right.
You have to be that person. But if you don't ask, we can't help you. We're
and
not
no dumb question.
We can't read.
Right.
I mean, it might seem dumb to them, but it's not going to be dumb to us. We're going to be like, okay, well, let's answer this head on.
Especially if it changes especially if it changes your health outcomes in a positive way. It can only help.
That's true. That's true.
So can you name something? I know we always touch on women's health because, you know what I'm saying, women are, to me, women are the lifeline of the community because, like you said, there's a lot of single mothers out here. There's a lot of things. Not saying anything bad about the men in the community itself, but women are most of the people that keep us together. Your grandma holds you together, most of the families. The mom holds it together. And so can you just tell us some of the common services that NMC addresses specifically to women's health and how important it is?
So just when it comes to general health care, hypertension, hyperlipidemia, diabetes, abnormal pap smears. That's definitely one that we want to make sure that you get your annual pap smear. Come on in, let the providers do your exam, get your results back. And if it's abnormal, we need to take other steps to figure out what's going on and get you the additional care that you need. Having an abnormal pap is very serious. We want to make sure that doesn't turn into cervical cancer, HPV. It's so many things that could be, that getting that just one exam, and a lot of women don't want to do it. We got to make sure we do it, because that's the difference. And sometimes you being here today and you staying with your family another 5 years. Just get the routine physical done. Your routine well woman. It is important for us to do it. Get a breast exam. Do your exams in the shower once a month. Make sure you know what your breasts feel like on a normal basis. Know when something feels abnormal. That's how you tell the difference. And bring that to your healthcare provider's attention. They can help. We're here to help.
Okay. I have a question, and I'm gonna replace this other question with this question that I have, because it just made me think, because the conversation flowing. So I do want to get that heads up. But leadership. Being in a leadership position, how did you learn leadership skills, and how would you define leadership in terms of making sure that you help to enhance the group of people that you're leading, rather than just yelling at them and talking at them,
Well, you don't get anything accomplished by yelling at people and berating people.
Right.
So it's definitely key for you to treat people the way you want to be treated, to lead people the way you want to be led. You're human. You have things that come up. Talk to people, get to know the people that work with you. That makes a huge difference. Sometimes people say, oh, you're too accessible, but I take pride in knowing everybody that works here. I take pride in being able to ask you how your children are doing. When my son came through the door a couple of weeks ago, everybody was looking like, that can't be Bryce. Like I remember when he was, little, coming up to my waist, and now I have to look up to him. That's just how much things change. So that's an amazing thing, to be able to see the people that you work with and watch their families grow and expand, and be there for them when things aren't the best, and then still be there when things are okay. That just changes the environment that you work in. This is a neighborhood family. It's not just where you work. We make sure we take care of each other, and that creates a great work environment. It makes it easier for you to work.
Right.
Open communication. That's what leadership is to me. Leading by example, definitely.
Yeah. You, and like we said earlier, you definitely do that, because when we out there in the hot sun sweating, you out there with us.
Oh yeah.
So we definitely appreciate that.
Oh yeah.
Yeah.
So I kind of want to switch gears a little bit. I'm going to do like Joe and change the question because I feel like this is, a big topic right now is the coronavirus pandemic, the COVID-19. What as a woman in healthcare, as a CEO, what would your message be to the community about how we can protect ourselves, and what are some things we need to do as a community to come together to try to help end this pandemic that's going on right now?
Well, I know that, I don't think any of us imagined that this would be our lives, and when we're coming into 2020. This has definitely been a different year and a half. A lot of people didn't make it.
Right.
A lot of people didn't make it, and that is sad. We got to take this thing seriously because it is not a joke. We have continued testing. Neighborhood is still be doing. We still do testing daily at our health centers. We have a community testing event this Sunday at the library in Cologne. Washing your hands, staying socially distant from people, wearing a mask. We've come a long way, but we're not out of the woods yet. We still, now that children 12 and up can get the vaccine. So that still leaves a great number of people, our young people, who are not vaccinated. We have a vaccine. Learn what you need to know about this vaccine, educate yourself, get vaccinated, and share that information with other people. Call us. We'll talk to you about the vaccine. Any questions you have, we'll be more than happy to answer those questions. But that shot is our best shot at getting back to some sense of normalcy. So, I know there's vaccine hesitancy. We got to work through this stuff. Some people say, oh, well, I'm just waiting to see what's going to happen. What are you waiting on? COVID is taking people out by the hundreds of thousands. Okay. We need to make sure that we stay on top of this. We do what we can to prevent the spread of this virus and hopefully eradicate it. Hopefully, that's what we're going to. I have 2 children who are not eligible to be vaccinated as of yet. So, you still have to be careful. You can't take this for granted. It's done way too much damage. We've seen it. We've had, some of our neighborhood family have lost people. Some of our neighborhood family have had to deal with the virus firsthand. We don't want that to continue. So if it means wearing a mask, I'm going to wear a mask because you know what? Wearing a mask does not violate any civil liberties that I have. It's keeping me safe. It's keeping my family safe. It's keeping you safe. So we're going to do it. And that's just that.
Exactly. Now, and I think we've done a great job of being a part of the pandemic and being a part of the prevention of it, because you contacted Mathias and I way back March, April of last year. And, we've been a part of the testing sites for the city. We've been a part of our own testing sites and now our vaccination clinics. And I think we do a great job. The system that we got in place, we're able to roll this thing out, and anywhere we go and get you in, boom, you in and out. We came, we saw, we conquered.
That's right.
And
people want to be like us, Joe.
They do.
Always. So, but I love the way we go about doing what we do. It's not hectic, it's not chaotic, even though sometimes we have some rough patches we need to work through. But in the end, you be like, well, dang, we done.
Yeah. And that's right.
Yeah, and people are taken care of. So I appreciate you explaining that for people. We're doing our best to fight this pandemic, and we need to continue that as a whole. So
it's gonna take a group effort. We can't go alone. Everybody come to the neighborhood, you need masks. We got masks. You need hand sanitizer. We got hand sanitizer. We just got to do what we got to do. Mask up.
Right.
So is there any things, I know that, because saying you hear people talk about, and you see the commercials where people are trying to encourage different populations and different ethnic groups and different sections of the city to get tested. Anything else that we can do that we're not doing already that you think that we need to do to help improve the population, especially like in Leon County, like Southside, North, everybody in Leon County, to get vaccinated? Because that's the thing. We're seeing multiple different people from multiple different races, everything come get tested, but we still have a big population who's like, I still don't want to do it. Like, what else do you think we can do, or how can we break those barriers? Do you think for a community health center?
I think the best thing for us to do is do what we keep doing, educating, going out, doing outreach, and just being here when people are ready. When you're ready, we're here. Until you're ready, we're going to continue to educate you, because that's all we can do at this point in time. You know, educate people about their healthcare decisions. Like I think when I was doing the Trusted Voices campaign, you know, I said if you trusted your healthcare providers before the pandemic, you can trust them now.
Right.
It's just that simple. If you trusted them then, trust them now. It's no difference. We're not going to tell you anything to harm or hinder you. So take a moment, get educated, learn about the vaccine, and then I think your level of comfort will be more. You know, I'm definitely encouraging people to do that, because we all want that you know, pre-COVID normalcy. Don't know if we'll get to that point again, but like I said, this shot is our best shot.
Mm-hmm.
Yep. So look, we gave y'all a wealth of information today. I hope you had your pen and your pad, had your whatever beverage, your coffee, your tea, whatever, to take the edge off, so you can sit back and enjoy this and watch it again with your friends and your family. Share this, share it. This is great information. And now you have more of an inside look at Neighborhood Medical Center, how we operate from the top down, and why we do what we do, and why we was able to get clear to do this podcast.
Right.
Well,
you know?
I must say that just for anybody who watches this podcast, I got to give a special shout out to Mathias and Joe for making this happen. You know, when the pandemic started, we just had to convert and do something different, and you all were right there, and you jumped on board, and you made it happen. And to your background, tech person, Ian, as we call it,
right.
You know, y'all have done an amazing job with this, so I am very proud to be affiliated with you all.
Thank you. And we want to give you a special shout out for always including us and improving and allowing us to see our visions through, from outreach to Ryan White to primary care to flyers to anything. You always allow us to be creative and do things. And we really want to thank you and the board of directors for allowing us to be who we are and be free and be able to serve the community and go in those dangerous zones that sometimes we might skate on. You like, got to reel you back in, but we really appreciate you and trusting us to grow neighborhood and the outreach program and those things in neighborhood to improve the community. So we really want to thank you for allowing us.
That is a good definition of leadership.
There you go. Yes, I like that. See, I like that. So somebody see this and they like, you know what? That Jeanne Freeman.
That's a bad girl.
Yeah.
So they want to get in contact with you. How can people get in contact with you to have you on their platforms and learn more about you?
The best way to reach out to me is at my email address, jfreeman@neighborhoodmedicalcenter.org.
Hey, J Freeman, neighborhoodmedicalcenter.org. And don't forget the website, neighborhoodmedicalcenter.org.
Yep,
right.
Check it out.
Right. And of course, our overall podcast website, nmcpodcast.com, where you can learn more about this podcast and see all of our past episodes and view future episodes, but also our monthly Healthy Happy Hours, where we partner with agencies, not just from the Tallahassee community, but from surrounding areas, and we get information about how they provide services to the community. And those are also on this YouTube channel. So subscribe to the channel, like, comment, share, and we here, man.
I love it. My resume. I did a podcast with Joe.
There you go.
There you go. It's gonna be famous.
Right. We got to do it. We need a little song and dance, and we'll be good.
I can't believe y'all don't have Ian DJing. I need background music.
I know.
We gonna have it.
We got some stuff coming.
We gonna edit. We gonna edit.
I need the podcast to be like our staff meetings.
I know, right?
Okay.
We got some stuff coming. Hey. Once again, this is Mind Your Body and Soul, the greatest health podcast ever in the world. He's Mathias Sweet, I'm Joseph Ward, and she is Miss Jeanne Freeman. And we here to make sure you all got the information you need. Remember, Mind Your Body and Soul, the educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information they may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to becoming the healthiest versions of themselves. nmcpodcast.com. neighborhoodmedicalcenter.org, and remember, we're on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course YouTube. Subscribe. So with that being said, Yes, I know. We out here. We out here in these podcast streets. So we'll see y'all next time. Peace out.